Hello everyone, hope you are doing well and spending some quality time for your studies. So today we will discuss a question related to abdominal aneurysm. The previous videos we have discussed about what is abdominal aneurysm and what are the treatment options and how to assess the patient to prevent the complications. So we'll start with our today's question. A client is 48 hours post abdominal aneurysm repair. Which assessment findings by the nurse is a cause for greatest concern? So in this question, we can say around 3 clues, which will help you to select the correct options. One is that 48 hours post-abdominal aneurysm. So the client is in a post-operative period and that is almost 48 hours. Then which assessment? So we know that after the surgery, we will be closely observing and monitoring the client for the expected and serious complications. So thus that is always we say like assessments. So what are the assessment we will do? Which are the expected one, which are the not expected one? Then another clue here you can see the greatest concern. So greatest concern means something went wrong. Something is not expected usually after the surgery, especially in this post-operative period, 48 hours of this post-operative period. So we will see the options one by one. Option 1, diminished breath sounds in bilateral lung bases. Option 2, hypoactive bowel sounds in all 4 quadrants. Option 3, urinary output of 90 ml in the past 4 hours. Option 4, warm extremities with the 1+ bilateral pedal pulses. Okay, those who know what is abdominal aneurysm and what are the normal assessment findings that commonly related to this surgery, especially during the 48 hours of postoperative period, might have got the correct answer. So we will discuss the options one by one. Option 1, here it says diminished breath sounds in the bilateral lung fields. Okay, so we know some of the common complications of this kind of surgery occur usually in the postoperative period. It's like we called atelectasis. I hope some of you have an idea what is atelectasis. See, especially when a client undergone abdominal aneurysm, they might have a severe pain. So what will happen? Because of that pain, they may not be able to do the proper breathing or the coughing that moments. They will not be able to do the deep inspiration because they are getting too much pain. So what will happen? The movements in the lung bases will be very diminished. That end up to atelectasis. So preventing that expected finding, what we usually do is that we will be medicate the client with analgesics, pain medications to help them to encourage the deep breathing, coughing exercise, and will provide instantaneous spirometry. So those will prevent the common complication or the common occurrence of atelectasis. I hope when we are explaining this option, you might be understand this is one of the expected assessment finding for a client who undergone abdominal aneurysm repair. So the question is asking something in the expected findings? No, the question is asking something the greatest concern and which is not usually occur in a client after the surgery, which is not an expected finding. So we can remove the option 1 because this is an expected outcome. So as an expected outcome, all the nurses who are taking care of the patients will be providing the necessary measures and will be taking the necessary interventions to prevent this atelectasis or complication. So we completely remove the option 1. So next our option is, it says here hypoactive bowel sounds in all 4 quadrants. Okay, hypoactive bowel sounds. So the surgery is doing abdominal aneurysm. It's during that time of surgery, what will happen? The bowels might be handled and manipulated, and most of the time it might be a long hours or a long period of surgery, prolonged surgery. So what will happen? It may take some more time to come back to the normal bowel movements and bowel sounds. So this is something expected. It's nothing to worry. Okay, oh, it's 48 hours. The client is not regained the bowel sounds. I find something wrong. No, it's not something. It's something expected. So what we are doing then, most of these cases, the client may have the nasogastric tube for the suction until the bowel sounds return, and we will be closely observing the client for the bowel movements and the presence of flatus. So that is not something will deviate our mind. That should not deviate our mind when we will say this one, because we know this is an abdominal aneurysm surgery, and this kind of like a diminished bowel movements or hyperactive bowel movements, something expected. We are taking the measures and we are observing the client to avoid the complications related to this assessment. So now we have removed option 1, option 2. Now we have 2 more options. Okay, let me ask you a wild guess. Out of these 2 options, which one you will select? What do you think? Out of this 2, like, which is the greatest concern that make you to feel, okay, this is something going wrong, I should take an immediate action? See, the option 4, it says warm extremities with 1 plus bilateral pedal pulses. Warm extremities, that is something good, right? Which means the client have a good blood flow, and it's with 1 plus bilateral pedal pulses. What you can do in this scenario, just compare the pulse with the preoperative status, and just see, okay, it's going everything good, and routinely monitor, keep closely observe the client. It's nothing fine, it's nothing wrong. But in case we found it's like cool extremities with a diminished pulse, then we should be thinking something going wrong, which means the blood flow is compromised. So I should take the action to prevent some of the unwanted complications. So now we got the answer. We have removed all the 3 options. Now we have only one option, that is option 3, urinary output of 90 ml in the past 4 hours. So here the first question I wanted to ask you is that, what is the normal urinary output of an adult client without having any kidney issues? 30 ml per hour is the expected normal urinary output of an adult client. In this option, they says that 90 ml for the past 4 hours, and it is 48 hours post-operative period or post-surgery. We are expecting at least 120 ml for the past 4 hours. So around 30 ml less, which means something is not okay, or something went wrong. That's why the client is not able to produce the sufficient, the normal amount of urine. In this scenario, we should just connect the dot. See, this is an abdominal aneurysm repair. So how the surgery is performing? It's a prolonged surgery, and the aortic, it might be clamped during the time of surgery. So what will happen? And there are chances of heavy blood loss, and it may be again we can find some like hypotension, then dehydration, then some cases like embolization. So these all things can happen, and these all things will happen. One of the another thing, what is leading to? So we said that the aortic clamping during the surgery, and that might be prolonged, that may end up the decreased renal perfusion, because the renal system is not getting the sufficient blood flow like the previous situation or the preoperative scenario, preoperative period. So what will happen? The long hours of this aortic clamping or the long hours of decreased receiving of blood to the renal system will happen the decreased renal perfusion. So if the renal perfusion is keep decreasing, what will happen? It will end up with the damage or the kidney injury. So when the kidney is injured, what will happen? Kidney is not able to produce the sufficient amount of urine. So that is what happening in this scenario. So if you are able to understand, okay, the surgery is doing in this way, so there are chances the kidney is not getting sufficient blood, okay, and if the urine output is not coming, it's something going wrong. If you are able to connect that way, you will be fine, end up with this option, and that would be the correct answer. And some of the other things we should closely monitor is that the blood urea nitrogen and the creatinine level. So these three measures, it's very important. We should be closely observe the client, and we are not always keep checking the blood urea. That is the routine monitoring. So when we are seeing the urine output, we can understand, okay, if this 4 hours it's less, maybe the next 4 hours again it will be more or less. It's like maybe the next 4 hours it might be 60 ml. So that is not something good. It's we are allowing the client to end up with some of the serious complications. We should not allow. We should take the action then and there. That immediate intervention will help the client to prevent the complications. Okay, so our answer for this question is option 3, urinary output of 90 ml in the past 4 hours. I think I might be explaining in a very elaborative way. I just wanted to clarify this one. And one more thing, I just discussed all the things related to this question because as you're expected, the things when we changing in the next like April or May, when you're planning to write the exam on the month of April or May, they might be putting the scenario, and that should not make you confused. That's why we are discussing each option in a very elaborate way. So if they will be connecting in a different way, or they are putting the answer options in a very long sentence, you should be able to understand and click just to pick up the glow points from that answer as well as the question. So that will help you to find the correct answer. I hope you understand this question. If anyone have any doubt, or the way I discussed is not like understanding, or you find some difficulty, or you feel it's not connecting, as I said, if the dots are not connecting, please leave a message or please comment below this video, so we will discuss that part more clearly. And I wish you all the best. Bye bye.